Governor, first of all, thanks for sitting down. I know it's a busy time for you. Very much appreciate your making some time for us. When did you realize that this COVID-19 pandemic was going to be as big as it's gotten? Were you late last year? Did you move from observation to mobilization? Was it earlier this year? Was it when Arkansas got its first patient? When was the realization for you that this was going to be major?
Well, like many Americans, when I first saw that this hit in China, I thought that it would probably be confined there. And then when I saw that we canceled flights, I knew that this is getting very serious because I was at Homeland Security during the SARS episode, and we did not cancel flights during that time. We managed them totally differently, and I'm thinking this must be highly contagious in order to take that extra measure. And that's when I became concerned and watchful about it. And then when it hit Washington State, of course, I knew that it would eventually spread. You did not know at that point the extent of it. But we really started our planning at that point as to, what steps do we need to take. And of course, Dr. Smith, our Department of Health, was saying this is something that you've got to keep an eye on.
So it was really Washington State kind of triggered, we need to really get our stuff in order here in Arkansas.
That's right, that's right.
A lot of people want to place some blame on this crisis. It's disrupted their lives, it's disrupted their kids' lives, it's disrupted commerce, it's obviously a huge health risk. Is China to blame for this, as Senator Tom Cotton kind of repeatedly says? A lot of people want to blame the Trump administration for not being as prepared as they could have been. What do you think could have been done differently to prevent it from being as major as it has been?
Well, that's a good question. And first of all, I don't think it's the right time to be in the blame game. I'm in the mitigation mode and the emergency mode of dealing with this crisis. Whenever you look at a pandemic, that we've had them periodically in our history, and we've always, where it comes from really doesn't make that much difference. Now, China is to be blamed because they aren't as transparent as they should be, and we had a hard time getting accurate information early. But in terms of, I just don't think this is the right time to be second guessing. Whenever you look at what we could have do, obviously now we realize we shouldn't have all of our production for medical supplies in China. We're struggling there now, and it's a global shortage. Sure, we'd like to have returned some of that manufacturing to the United States of America some time ago. Who would have thought that ventilators would be something that the state of Arkansas is desperately trying to procure, and that we would invoke the Defense Production Act in order to require General Motors to produce ventilators. I don't know if these things can see that far in the future. And whenever you look at President Trump, he's tried to return manufacturing here in the United States. That's what I've tried to do. And we've had certain success, but obviously this points up still the delta, the gap that we have, and that we have to have this capacity here, whether it's medical supplies or whether it's other things.
Yeah, he did for quite some time. The president did call it a hoax. He did call it something that was going to go away. It was going to get reduced to zero. Do you think he was not treating it seriously enough at that point in time? Back in late January, early February, when more could have been done in terms of preparation?
Whenever you look at the president's comments, he reflects his optimism. Sure, he said that he thought we'd be done by Easter. He hoped that it wouldn't be there. He was trying to make sure people were pumped up and continued to encourage the economy. Those statements in retrospect do not look like they're long-lasting, but my goodness, he's trying to give hope. Now you've got to give honest hope and realistic expectations, and certainly I think he's learned with his health team that that's how he's got to communicate to America, and he's been very frank with us in the last couple of weeks, letting us know exactly the trauma that's ahead for America.
When you walk me through a little bit of the process of how the procurement process has gone. I know that's been a big struggle for you and your administration. You're competing against other states, you're competing against the other countries. Just where are we today in terms of what you think is in the pipeline and coming to Arkansas? Do you think it's going to be at the level where we've got enough to supply our hospitals and healthcare workers with what they need on the front lines?
Well, it is the greatest need that we have in terms of making sure that our healthcare providers, our doctors, our nurses have the protective equipment they need. They're heroes, and they can never run short. And so we're doing everything that we can to make sure that supply chain is there. One of the smart things we did early on was not simply leave every hospital up to compete for themselves in the marketplace. We put together $30 million to begin with that grew to $75 million to actually jumpstart the procurement and to allow us to do it in bulk for the whole state. That was one of the smartest things we were able to do. Then we realized even the challenge with that level of commitment. And we've had challenges not just in China, but in Germany as well, with a shipment coming from there. But right now, we have our first shipment received today from what we have procured as a state. It will be distributed over the weekend to the medical community so that they don't run short. This is probably about a 30-day supply that we'll be getting in over the next 3 or 4 days through various shipments. 30-day supply, which means we have to immediately get back on the phone. We have to work with our suppliers to get not just product, we have to buy production time on the assembly line, on the manufacturing floor, and a commitment from the manufacturer to produce the quantity, buy the time, and then once it's produced, to get the shipping and the logistics back here, which is taking air freight. And that's whenever we're competing not just against other states, but the Department of Defense as well.
Do you, have you thought about partnering with some other states on this? Do you wish there was more of a national coordination strategy on this?
I urged very early on that the National Defense Production Act be invoked because I could see what's ahead for us, this competition, and so the President has invoked it, and I particularly am glad he did it on ventilators. But even with that, there's going to be a shortage of ventilators, and they're right now triaging the ventilators and the supply chain where they go. And so the priority is on the hot spots. It's New York, it's Connecticut, it's Washington State, it's New Orleans. And so we're being told in terms of the national supply chain, we'll get to you. You're not a hot spot yet. We're working on other places. And when you need ventilators, you'll have ventilators. Well, that's somewhat reassuring, and I see that's what they have to do, but that still compels us to be out there trying to control our own future and to buy ventilators, to buy respirators, to buy swabs, to buy all the other equipment that we need. And so we're not going to simply wait on the federal government, although we hope that they will fight hard for that supply chain. We're going to have to be able to protect our own doctors and our citizens, and we're going to be trying to establish our own capability.
What gives you an advantage when you're making that argument to a supplier who can pretty much demand whatever price they want at this point in time, and the fact that there are other places that have needs that may be more critical in terms of volume versus Arkansas? How do you win that argument?
Well, you win the argument, or you make the argument that we've got a growing number of cases in Arkansas. We're doing well, but we have to have a supply of ventilators. We have to have protective masks. That's not a future issue, that's a present issue. It's an emergency issue right now for our state. And so you have to deal, first of all, with ethical suppliers and the supply chain that will not promise you something and then they get 25% higher offer or cash on the table and it's diverted.
Has that happened some?
Oh, it's happened. We've been at the last minute outbid by another state that offered a premium when it was promised to us. And another instance, another country simply confiscated it because they needed that protective equipment because they have their own outbreak. And so we run into those things and we have to work through it. Every state has the same challenge. You ask about whether we ought to combine We have given some thought to that. That's something we're continuing to look at to see if that concentrated buying power would give some advantage to us.
You've taken a lot of criticism for not calling for a stay-at-home order or shelter-in-place order. Arkansas is one of the few states that has not done that. Your argument has been that there are already quite a few things that you've put limitations on, and you don't see the need for it to be differently. That's gotten through to me. But who would be affected if you were to put a shelter-in-place in order? What would be a business or businesses that would be affected by that?
Well, there would be well over 100,000 employees that would be out of work and on the unemployment line if we put a shelter-in-place order in today.
Would it not be more protective, though, to do that? I mean, do you see the argument for the public health perspective of doing that?
Well, you asked me the consequences of it. Now, if you want to talk about the public health consequences, that's a different issue. And we will listen to our public health experts, and if any time they tell me we have to have a shelter-in-place order, it's done. We work together on this, and we're looking at the data, we're looking at the science. But you've got to, when you look at the public health consequence, think about it in these terms, that if I put a shelter-in-place order today, then people think, well, that means everybody's got to stay in their home tomorrow. Tomorrow morning you wake up and over 700,000 Arkansans will hit the streets again to go to their place of employment because they are in essential industries. And there'll be people still going out to the grocery store because every state that has a shelter in place recognize you still have to produce the electricity, you have to supply the food chain, you have to do the agricultural work, you have to make sure that the streets are paved and the government goes on and the services are provided. And so all of that amounts to about 700,000 workers, and so that is, you don't receive any public health benefit from it that we can see at this point. And we'll measure this every day. If our targeted strategy is not working, if we're not having success in bending that curve, we'll change it. We're open to having stronger measures in place, but I don't want to put 100,000 people out of work in the unemployment line if there's not a good public health benefit to justify that.
One of the things that you've predicated this decision making on is this projected curve of where you think Arkansas will be in terms of illnesses and then what the test results are showing you. I think it's this graph that you have displayed in your press conferences a few times here. Let's talk a little bit about this, because this is some of the support for and criticism against this, is that we don't have a lot of tests in place. I think we're just a little under 10,000 as you and I sit down. We have 3 million people in the state of Arkansas. That's literally 0.3% of the population's been tested. Is that a big enough sample in your mind?
Well, you sample this 3 million people in the state of Arkansas by polling 400 or 800. And you consider that a scientific sample of the state. We've polled over 10,000 that we have a sample of, and so yes, statistically it is very, very helpful, particularly whenever we've covered every aspect of the state. But you also have to compare it with where we are with the other states, and every state is struggling with the number of tests that are out there, and so our numbers are still comparable to other states that are struggling with testing as well. So we're doing as well on testing, and we're beating the curve in terms of our cases. And you can argue back and forth about, well, what does that show you if we're not doing enough testing in terms of the number of cases? But what you can look at is the number of hospitalizations as well, because that's real information. If somebody is sick with COVID-19, they're not staying at home, they're going to the hospital. And the hospitalizations are at 66, I think, yesterday. I think it's a little bit over 70 today. But that number is solid. It tells us where we are in our state as well. And so here again, based upon that information, it's a heartache for us, because these are 70 people. We've had, a dozen deaths here in Arkansas. But we are not going up in terms of the projections like everybody said we would, which means our social distancing is working, our protective measures that are in place are working, and that we're going to reduce the height of that curve whenever we get there. And and we'll continue to look at it, see if we have to do more.
Again, to play devil's advocate, if I take your numbers and you've had about a 7.3% rate of those that you've tested have come back positive, if you extrapolate that against a population of 3 million, that's over 200,000 people that could possibly be infected in the state of Arkansas. That would be well above the blue line that you have here. What happens when this red line goes above the blue line? What do you do differently at that point in time?
Well, if that red line goes above the blue line, that means that we're not meeting the projections, we're not beating the curve, we have to take stronger measures. That's exactly the trigger point that I'm looking at. But that's not where we are, and if you had, it's not true that you have that number of cases, because if you take the national percentage of hospitalization, like in New York, it's about 12% of the cases that are hospitalized. Our hospitals right now would be overrun with COVID patients, and we have, less than 100. And so that's the kind of information that we have to have, the data we have to make good decisions.
Yeah, unless they're asymptomatic. There could be plenty of asymptomatic people walking around that could be spreading the infection, couldn't there?
Yes, you could have asymptomatic people, and that's why we test as many as we can. Other states do. But our curve is built upon those projections by data scientists that look at where we are and where we're going. And these are my projections. These are projections of our Arkansas Department of Health. And whenever we're beating those projections, that means we're doing something right. And not me, but it's the people of Arkansas that takes this seriously. They're staying at home. They're doing essential work. They are socially distancing, and they're taking care of themselves and each other. And that's why we're having that limited growth that you see.
You have closed the schools in the state of Arkansas till April 17th. The president has kind of not put an order down, but has suggested April 30th might be the best way to socially distance. When are you going to readdress this April 17th issue on the public schools in Arkansas? Are you looking already at pushing that date back or ending the school year altogether?
I talked to Secretary Key today, and we talked about the schools. We intend to make an announcement on Monday as to what's ahead, and he wants to put some plans together as to exactly how we address that in our schools. Obviously, you're not going to reopen the schools whenever you're continuing to go up in your cases, but we also want to make sure that we have all of our facts together before we make a final decision next Monday.
So you're not going to tell me, is what you're saying?
I will tell you something, though, that just about an hour ago we received word from the federal government that we have been declared a major disaster area, which will open up the doors for federal assistance here in Arkansas. That was a response to my request and our federal delegation.
When we look at the death count in Arkansas, which is a sobering statistic, you don't want anybody to be dying from this, but it is obviously has climbed over the last several weeks, several days. Have you talked to any of the families that have lost a loved one in this instance, or have they reached out to you?
I've not talked personally to a family member that's been lost. I've certainly heard their stories, and I do have someone on the Arkansas team that has lost a loved one, and so it is personal to so many that have colleagues that and friends that have been impacted by it.
What does a post-COVID-19 Arkansas look like? What do you think is going to be different about health, lifestyle, commerce? What's going to be different once we get through the crest and the wave of all of this?
A number of things, and I think it's caused us to rethink healthcare. Obviously, telemedicine is going to be more permanently with us and expanded as a result of what we can see we can do through telehealth in this emergency circumstance. So that'll change. I think the physical structure of hospitals and clinics will change to a certain extent because people now, rather than waiting in a waiting room, even if you don't have a virus circumstance, you can wait in other places and come in at a right time. So I think a lot of things, how we deliver services will have a second look. I think education as well. Do we need this many buildings in higher education? If we can switch this readily and quickly to online formats, should we do more in that kind of format and reduce the expensive investment in buildings on college campuses? So there's a lot of questions that will be asked like that, and I think we'll see what changes can be made that are good. Some changes, I hope, are very temporary, and that is the social distancing. We're in the South, we're compassionate people, we believe in the human touch, and that's the hard thing that we're dealing with now.
What are you not getting done that you had on your agenda to be getting done because this has been so time consuming for you? Are you worried about the highway tax program? Are you worried about other things that were on your agenda that you're not able to focus on right now?
Oh, there's a lot of things that are going to be delayed, or we're not able to focus on that. One of them is our crisis stabilization units. We wanted to expand that program. It's probably going to be difficult to expand that now in the budget environment, but also with everything in turmoil in healthcare. Whenever you look at future tax cuts, that's going to be a little bit more challenging with the constrained budget that we have.
You're saying we're not going to get to that 5% level in the next session or two, is what you're saying?
It's going to be hard. It's going to be hard. We're going to go to 5.9% next year. I think we can manage that, but beyond that, we're going to have some good economic growth before we can sustain that.
What about the highway program?
Highway program, I think it's still widely supported in Arkansas, issue 1. I expect that to hopefully pass on the ballot in November, because we'll probably not only need that investment in infrastructure more than ever, but also the boost to the economy in terms of putting money out there for creating jobs at that point. We might need to have a reboost, and I think that will help in that as well. So I'm still very optimistic that the people of Arkansas will maintain that support for that.
The legislature is coming to town this next week for their fiscal session that they do in the even-numbered years. We've had 2 legislators so far, as we sit down and talk, have tested positive for COVID-19. Is it still a good idea for 135 lawmakers from around the state to come to the capital city and obviously practice social distancing, but take an additional risk of being in the same room and in some same circumstances, then go back to their communities?
Well, it is important to follow the Constitution, and the Constitution requires that.
It could be done through technology. There's some other ways for them to communicate with each other, whether it's conference calls or other things that technology allows them to do. Should they explore that more than coming together and physically being in a room?
Well, I think they are. And so they've allowed for proxy voting. They've allowed for anybody who feels unsafe and come in that environment to stay home. So they're working through both the safety measures and the practicality of physically being here. But I hope that in our country, that's one thing I hope we don't do by online, and that is our representative form of government, that we stay in our states and we just electronically vote in Washington. There's something very important about the speech and debate clause in the Constitution that I have a high regard for, and there's nothing that beats face-to-face discussion of important issues. So I hope that this is a temporary issue, and they're making every accommodation during this time, but we have to have a budget. The Constitution requires it, and they're taking the precautions. So we're going to be very careful, because it's our lives, it's our family lives, and the public's lives that's at stake.
You've advocated for reducing another $200+ million from the budget for the next fiscal year as a result of everything that's happening in the economy. Is that going to be enough? I mean, are you trying to be a little cautious here on the front end? Do you think it's going to be more than that eventually, and you can revise that forecast down the road?
I have confidence in our projections, our economic forecasting. Of course, a part of the reason it's only that amount of money is because we're shifting some of the income tax revenue from this fiscal year into the next fiscal year, so that's somewhat of an offset. There's also a huge amount of unpredictability. could go south and be worse, and we'll have to adjust the revenue forecast again. I don't think so. I think this is a good forecast to have, but we're going to have to wait and see how long this emergency goes on, and then how long it takes our economy to recover from it. It is a good sign that we had a good February. Our economy has all the right foundations in Arkansas. I'm hoping if this delay is not too long, we'll pick up where we left off.
About a week ago, a tornado ripped through downtown Jonesboro, did some tremendous property damage. Fortunately, no loss of life. There were some injuries, but none critical. How difficult is it to manage an emergency response like that at the same time as you're dealing with a once in, hopefully a lifetime, but certainly once in a generation pandemic that's the scale and scope that we have?
It's difficult. It's difficult for our emergency managers, but it's most difficult for the people of Jonesboro, that they're having to recover from a tornado and extraordinary damage to their community at a time that you're not supposed to be in close proximity to each other. Volunteers are coming everywhere because that's the compassion of Arkansas, and they're having to say, well, keep your distance, or we might not be able to use that many volunteers. So people of Jonesboro have just been extraordinary, how they've organized it, how they've gone through this with fortitude under difficult circumstances. For me, and for the state, it's a double hit. We've got two emergencies and federal declarations that I would assume will happen for both these disasters, and that's unusual in history, and it's tough.
When you campaigned for governor in 2014, I can't find anywhere in any of your campaign rhetoric or any of your websites, anything where you campaigned for being the emergency governor, like something of this magnitude. How prepared do you think you have been for this based on your lifetime of experience? And how has that kind of helped you navigate what we're dealing with right now?
I've had a substantial amount of experience that prepared me for this moment, and I say this humbly, but it's just the reality. I was at Homeland Security after 9/11, dealing with the SARS epidemic, but also dealing with terrorism in our borders and dealing in an emergency situation. Most important experience is how you marshal the different resources of government together to respond to any emergency, whether it's terrorism or whether it's a pandemic. And I'm very blessed with is that I've got a chief of staff that's been through that as well. And we've got an incredible team that's working very hard, but we're blessed to have that kind of experience that can see how to marshal resources, federal and state, to match this incredible challenge that we have.
Last question for you. Before we sat down, we half-jokingly asked each other, when do you think this is going to end? When do you think this is going to end? You're the governor, so I get to ask the question. When do you think it will get better? Because I think, and I think you believe this too, it's going to get worse before it gets better.
It is. I mean, our numbers are going to go up, even though we beat the curve and we reduced the height of the peak of the numbers that we have in Arkansas. They are going to go up. We're going to have more hospitalizations. We'll have some more deaths. And how long it lasts is undetermined at this point. Obviously, we hope that April will end the peak, and that we'll start going down after that and start the recovery. That's what we're counting on. And that's one of the reasons. I mean, how long can you stay cooped up in your house? For survival, you do it as long as you need to. But in terms of mental health, in terms of productivity, we hope that's as short as it can be.
All right. Thank you for your time, Governor.
Thank you.